Okay. So this last session, again, as is said in family planning parlance, when there's no product, there's no service. So we have to talk about commodities and commodity security, because it's one thing to have the commodities and ensure that those commodities are secure and they get to the last mile. So it gives me pleasure to invite moderators for this last session. Representing Mr. Mike Edbo today is Mr. Kenny Otto. He is the Deputy Country Director of GHSC PSM. Mr. Kenny Otto, please. Please welcome to the high table. Mr. Lawrence Ayahu, you are acting for Dr. Afolabi, but now you are required to act for yourself. So Mr. Lawrence Ayahu, please come back to the high table to moderate. So I'll pass on the microphone to both Mr. Otto and Mr. Ayahu to take us through this session.
Good evening, everyone. Good evening, everyone. I think it's about that time of the day where the sugar level goes down. But we just need to inspire ourselves to wrap this up in a very short time. We all have homes to go to, but this is a very important session. So let's keep our focus for the next few minutes. So my name is Kehinde Otto. I'm the Deputy Country Director for the Global Health Supply Chain Procurement and Supply Management project in Nigeria. I'm sitting in for my boss, the Country Director of GHSC PSM, and Mr. Lawrence Ayahu.
Okay, thank you. My name once again is Lawrence Ayahu. I'm Director of Family Planning in the Federal Ministry of Health. And I'm going to be co-facilitating with the Principal Officer from GHSC PSM project. This session is about ensuring commodity security, family planning commodity security through innovative ways of ensuring end-to-end visibility. What are the things that we need to do to ensure that commodities are available at the facilities where they are needed? And there are some steps that are being taken by stakeholders, both nationally and internationally. A few of those steps, a few of those applications that are being put to use to facilitate improved performance of the supply chain for family planning, commodity management. We are going to be listening to presentations on them. So the people are coming from, the presenters are coming from GHSC PSM project, where Kenny Otto works. So I will give him the microphone to introduce his team to make this very important presentation. Thank you. Kenny, over.
Yeah, thank you, sir. Without further ado, I would like to call the following presenters to make the presentation to the House. Dr. Maria Saleh, and also I'll call up Atoyeshe Denyibo, Abubakar Mohammed, and I'll call Bruno to the stage to make the presentation. This plenary will focus primarily on end-to-end visibility, how you can ensure commodity visibility to the last mile. So I'll hand it over to Dr. Saleh. Thank you.
Good evening, everybody. I don't know if we could have the slides put up. So before they put up the slides, very quickly, we'll be speaking about visibility of family planning products as they move across the supply chain. That's from end to end, from the level of the manufacturer all the way to the last mile, to the end user. Just a few minutes while they put up the slides. Okay, thank you very much. Next slide, please. Okay, next slide, please. Next slide. Next slide. All right, so this is just a snapshot of the flow of family planning commodities and information as it moves through the national supply chain system. It shows the movement as it comes in through the ports, all the way through to the central contraceptives warehouse in Lagos, to the state warehouse or axial warehouse in the case of GHS-CPSM supported states, and then to the service delivery point. There are other nodal points, and that indicates the flow of information. That's the dotted line. It flows upward from the service delivery point all the way to the repository at the national level. Next slide, please. So this is just so that we have this at the back of our minds as we listen to the presentation. So this is just outlining challenges to health supply chain in Nigeria. Today, we are focusing on poor visibility into supply chain activities. Next slide. So these are the 4 elements of supply chain transformation: the people, the processes, technology, and policy. Next slide. Next one, just move it one. Hello? Can you move it? Yeah. And we would also like you to have this at the back of your mind. This is the complexity of activities that happens to get commodities to the last mile. It's hard for me to see from here, but so starting from data collection all the way to when it gets to the last mile. Next slide. All right. So today we're just going to focus on one of those 4 elements that we mentioned, and it's going to be technology. Move one, please. Next slide. Next slide. All right. So the role that technology plays in supply chain transformation, which is one of the areas that GHS-CPSM is working in, is to ensure integration and tightening of supply chain processes, and ensure that information is linked between the various functions of the supply chain. So next slide. So these are all of the processes that happen within the supply chain. If you look at the arrow at the bottom of the screen, commodities need to be planned for, they need to be sourced, they need to be made or produced by the supplier, and they need to be delivered. And then there's also the return element, that is backflow. Next slide. So today we'll present some technology solutions that GHS-CPSM has been championing to improve supply chain visibility. We'll be looking at the upstream intervention, and that is the Global FP Visibility and Analytics Network, the GFP VAN. We'll also be looking at downstream interventions within the country, that is the National Logistics Management Information System, NHLMIS. And we'll also look at how all of these processes speak to each other via coordination, how we use the data, what platforms are used to move this forward. Next slide. I think I'll hand over to the next speaker, Runo.
Thank you so much, Dr. Maria. Good evening again, everyone. So I'll be speaking on the Global Family Planning Visibility Analytics Network. Next slide, please. So basically, the FPM supply chain system is a complex one that comprises of a number of key players as well as processes that require a platform for aligning all these processes to work effectively. The GFP VAN provides that platform. It's actually a shared platform to capture and use family planning supply chain data from multiple sources and organizations to provide enhanced visibility for decision making. What this platform does for us, prior to having this platform, what it does for us currently is that where we had a system where we had parallel supply chain, parallel data elements, where we were not having clear visibility into what was going on around the various processes. The GFP VAN has made it such a way that you have a single platform for having all these interactions on that. It's worth mentioning that this platform happens to be, Nigeria is one of the 3 countries, Nigeria, Ghana, and Malawi, that have actually deployed this technology. And it's actually a high, it's one of our high impact, sorry, I'm not simple, one of our high impact practices, yes. Next slide. We're going to play a short video just to give us an idea of what the GFP VAN is in totality. If they are able to, are you able to play the video, please? You could just click on the link. There's a link below, please. It's load, okay. There's volume, yes. I think they can. It's coming up.
In our business of reaching women with the right family planning commodity at the right time, the right data can make the difference between health and sickness, life and death. These commodities must take long and difficult journeys. At every stage of that journey, decision makers need data to see where the commodities are and to answer key questions. Procurers need to know how many units of each commodity to buy and for whom. Manufacturers ask how much to produce and by when. Shippers must decide which commodities to send where. The central medical store needs to know which commodities to order and when they will arrive. Until finally, the commodities reach the world's poorest women and girls. Insufficient or incorrect data at any of these stages will send wrong messages through the supply chain, resulting in stockouts, overstocks, expiration, wastage, and ultimately empty hands. Since 2004, the Reproductive Health Suppliers Coalition and its members have been developing tools and groups to get the right data to answer answer these important questions. These tools tell us who has purchased commodities, how much, and what countries' stock levels are. We've brought together specialists to use these tools to help prevent and respond to stock crises. Now imagine if we could get all these tools and groups to break out of their silos and contribute to a single shared virtual platform where the community can see and use the same data to make supply chain decisions together. What you are imagining is a global family planning, visibility and analytics network, or global FP-VAN. It will link procurers, manufacturers, shippers and countries in an active network focused on product flow into these countries. They will use a new data hub that captures data from many sources and provides a single decision-making platform. New processes will transform how they interact, analyze the data on the hub, and make decisions together. There will be harmonized policies around data sharing and use. The Global Family Planning Van is the natural migration of more than 10 years of work onto a more advanced, flexible platform that will allow people to simultaneously see the same data and make decisions together. Given the Coalition's foundational work in this domain, the community has entrusted the management of the Global Family Planning Van to the Coalition. Financial support is coming from committed change leaders, starting with an 18-month pilot. At the center of the pilot will be a focus on countries, a vital component because countries link incoming orders with women. As countries embark on their own data initiatives to strengthen national supply chains, upstream global van and downstream country efforts will build toward one another with a view to linking up our systems. This eventual link will let us see together where commodities are, all the way down to the last mile. This visibility will help us answer our key questions. This will transform the way decisions are made forever, helping us to reach more women with the right product at the right time. The Global Family Planning Van is the Coalition's biggest undertaking to date and must be a community effort. Join us as we change forever the way our supply chains work, and in doing so, the way we reach her with the family planning she needs.
Thank you. Hello? Thank you for... Hello? Can you hear me? Okay. Thank you for sharing that beautiful clip. I'm sure we found it very fascinating. It actually gave us a holistic picture. It actually gave us a holistic view of what we plan to see for the future. However, currently in Nigeria, we are at a state where we've started using this platform, and it has helped improve, it has led to an increased upstream of data visibility for us across our various players, ranging from our country program managers, family health department, as well as the manufacturers. This has also helped us to be able to have to manage stock imbalances, increased visibility into our data set, as well as increased family planning choices for our end users. However, although we have a national upstream visibility into this platform, we still in the future are looking to incorporate other components that will make it holistic. The components we're looking to include is the NHLMI's component, which is the National Health Logistic Management Information System that houses our consumption data, and the Warehouse Management Information System, which houses our stock on hand data. That way we get to have greater visibility at the lower levels. If we have an upstream visibility and a downstream visibility, that will give us a total end-to-end visibility, adding in all the other factors. Hopefully, we hope that this, of course, would end up helping to attain our goal, which is, of course, ensuring that FP commodity security is attained using this technology platform. So I think I will hand over to the next presenter to continue.
Bruno, thank you for that presentation on upstream visibility, looking at GFP VAN. I will take it from here, and what we will be looking at is in-country visibility, looking at the Nigeria Health Logistic Management Information System, a cloud-based technology developed in-country by funders with the government of Nigeria, providing that leadership where all the tools and all our in-country supply chain processes were translated into that tool. And that tool is what is being used to manage in-country supply. So let's give credit to USAID, the Global Fund, UNFPA, and other development partners who provided the fund to ensure that this was designed, developed, and deployed, which is currently in use by the country. So the Nigeria. Okay, next slide. Next, so the third one. Next, yeah. Next. So this tool itself has a lot of functionalities. These functionalities, they cut across our supply chain process. That is, they provide not just data visibility, but then we also have what we call operational visibility. We have visibility to actors who are interacting with the platform. So in terms of functionality of this tool, there are about 7 of them which are key. And this functionality in the long run, they help in providing that visibility that contributed eventually to what our commodity security. This first feature is the stock reporting, which is what you are seeing. This is the gateway. So it's the tool itself houses virtually all the public health commodities, malaria, family planning, maternal and child health, TB, and vaccine. So it's a one-stop shop for this. And that is the gateway where you have visibility into the report that has been entered into the system. You just select the right program and then you enter the report. Once the reports have been entered into the system also runs on the background a query to check for data quality. So meaning this tool at a glance and at real time is able to query all the reports that are in the system and flag those with issues. This provides visibility to all the people who are entering reports or the supply chain actors at the state to be able to make corrections to those reports or provide feedback to those at service delivery point. Next slide. So the third functionality is the performance management itself. This visibility tool gives you an instance, real-time instance of our indicators. You have visibility to your reporting rate, you have visibility to your data quality incidents, you have visibility to your stock, the stock that is available within the country, which is measured by stock out, and then you also have visibility into month of stock. So all these guides our players both at the national level and at state level and at the local government level to be able to support our supply chain operations. And you have granularity down to the state, to the LGA, to that individual facility in terms of their performances. So this is real time. Beyond that, once you have this visibility, the tool itself houses an ordering interface where the people at the state level or the LGA level are able to place orders on behalf of their facilities, which get moved to either the state level and down to the national level, where these are aggregated based on the warehouses that is there, based on the stock that is available, and you are able to assign or ration products for this. So beyond this, the tool is able to do shipment planning, in-country shipment planning, in-country pipeline tracking, and it has the administrative interface that allows you to manage not just the master data, but the facilities and the people who have access onto the platform. So this is a quick overview of what the tool has done for this country and will continue to do. So in terms of the scale of operation, which is my end submission before I hand it over to the next presenter, is that this visibility tool itself or so it's on, yeah. Maybe my global audience can hear me, but then those here at the table, they can't, yeah.
They can't hear. So we have a break in transmission, right? Yeah. So while we wait, if our international audience can hear us, we're going through transmission, right? So let them know.
Yeah, I'm back. Thank you. Apologies for the break in transmission. I will continue. So I provided an insight into what the tool is able to do. The next thing that I want to say before I hand over to Asia is the scale of our operation. So this visibility tool currently houses over 40,000 service delivery points, both public and private. About 11,000 users currently have access to the platform to either enter data or to review reports or to create orders or to support performance management. In terms of last mile operations, on bi-monthly basis, we deliver about 100,000 stock keeping units of commodity, which is equivalent to about Olympic size pool in terms of volume of the commodities that are moved downstream on bi-monthly basis. The tool itself is able to can support integration with other enterprise tools. One of them is DHIS that has been done. The tool communicates with VHIS, which means the tool platform can exchange data. The tool is also has been integrated with 6 of our axial warehouses where we have real-time visibility into stock in these warehouses. Part of the future integration that is on the table is integration with global GFP van, where the consumption and stock on hand, whether at the warehouse or from the service delivery point, will be integrated real time with GFP van, and that will give us how to provide that end-to-end visibility that we are looking at. And once that is done, yes, we will have that real complete integration and complete visibility from the manufacturer down to the last mile. Thank you. Atoesha, over to you for coordination.
Thank you very much, everyone that has spoken before me. So they have all spoken beautifully well about advanced and friendly technology. At the beginning, Dr. Maria talked about people, processes, policy, and technology. And then the question is, if we have all this beautiful technology, and then we don't have the people on ground to coordinate all of these processes, then what happens? So what makes coordination important? Can we move to the next slide, please? So coordination is important because in supply chain, for instance, you want to be able to manage the demand and supply side of the supply chain. You want to be sure that from the demand creation to meeting the needs of every woman that goes to the health facilities, the supply chain is being coordinated from the beginning to the end. So coordination helps us to achieve this. So what happens in a place where we do not have coordination? We can have some of those effects that can backfire on the supply chain system. For instance, you can have people at the service delivery point, requesting for more than they need because they think there might be a disruption in the system. And this eventually actually affects the system because you in planning your supply chain, you may be requesting for more than the country needs. So these are some of the things that coordination helps us to address. So we call that the bullwhip effect. So in country, what do we do in terms of coordination? There are actually coordination at different levels. So for instance, at the federal level, some coordination mechanisms have been put in place. And the reason why we have this is not just for the real-time coordination, but to also ensure that there are sustainable mechanisms in place to ensure that our supply chain is effectively managed. So at the federal level, for instance, we have the contraceptives PSM TWG, which is the subcommittee, the PSM subcommittee of the National Reproductive Health Technical Working Group. At the PSM TWG, all decisions regarding supply chain or family planning is taken. For instance, what do we order? What products do we order? Do we want to introduce new methods? What quantities are we ordering? When should we have the commodities move in country? Up to the distribution of these commodities. Similarly, at the state level, we have the State Logistics Management Coordination Unit, which is a vehicle, a government vehicle that helps us to manage supply chain. At that level, however, it is integrated across the different public health programs. So you have all of these mechanisms in place to ensure supply chain is coordinated. We have also piloted in 5 of our supported states, Bauchi, Ebonyi, Kebbi, Sokoto, and also the Federal Capital Territory. We've piloted the family planning coordination meeting. And one of the things we have been able to do with this new mechanism is to ensure that there is data triangulation. For instance, we want to be able to look at what is happening at the service delivery, looking at the health management information system, and then the NHLMIS that my colleague has passionately talked about. to ensure that the demands, we have commodities to meet the demands that are coming into the service delivery points. So these are some of the coordination mechanisms that have been put in place. However, in strengthening or supporting government in the journey to self-reliance, we still look at, having some of these coordination mechanisms strengthened. At this point, I'll hand over to Dr. Maria again to talk to us about sustainability of all of these technology and coordination mechanisms we've talked about. Thank you.
All right, thanks, TY. Next slide, please. Next. All right, so we just want to wrap up with these key points. We know a lot of investment has gone into these platforms. We're also thinking about how they can be sustained beyond the life of this project, GHS-CPSM. So we're looking at the state level as they begin to procure their own FP commodities. And we need to also have increased visibility into what commodities, the status of commodities in their warehouses. We are conducting advocacy to the state level to invest in warehouse management systems, which ultimately can be linked to the GFP van and even the NHLMIS. We're also looking at funding mechanisms which should ensure the maintenance of the platform. Next, please. So there are some options. Next, yes. So private sector investment in the platform. We're looking at drug revolving funds and then dedicated budget lines to maintain the platforms. At this point, I'll hand over to the moderators. I believe this is the last slide. Thank you very much.
Yeah, thank you so much for the presentation. To the presenters, Dr. Maria, Bruno, Abubakar, and Ateyeshe, you've done very well. I've been privileged to understand and use the system over the couple of years that we established it. I know there are some few questions, and we will run through those questions quickly so that we can get on with other events. Now, just to wrap up, we've talked about people, the processes, the technology, and the policy. Bringing it together is what we have presented now, or what the presenters have given to you now. The linkages from manufacturers to in-country and last mile to ensure that couples have choices. And to have couples have choices, commodities must be available. And so for it to be available, we must have the right technology to provide the visibility for decision making. So that is a key component of what the presenters have given on to us. So I'll hand it over to Mr. Anyanwu to ask some follow-on questions from the audience. Thank you. And I'm not sure if we have any questions from the international audience or people online. So we might take that as well. Thank you.
Okay, thank you, Kenny and presenters. The different phases of presentation, I must admit, were well handled, and the two key systems that were presented are familiar, and they are systems that the Federal Ministry of Health, on behalf of the federal government, is working hard with partners to entrench into the health commodity logistics system, especially now that we are working towards integrating the health commodity supply chain management system. So they are coming at the right time. We have a number of questions. I have comment I will make, but before then, we have a number of questions here. The first two questions will go to Abu Bakr, that handled the NHLMIS aspect. The first aspect of the question is, where is this dashboard hosted? Where is it being hosted? And then, uh, is it covering all the states? So maybe if you respond, we'll now go to the next set of questions.
All right, thank you. So the platform is currently managed by the government of Nigeria through the National Product Supply Chain Management System. They've taken over the ownership and they are in the driving seat. So the platform is structured as SAS, a structure as a service, as a service, meaning the developers are responsible for managing storage capacity, version release, and over time, and then making it available on the platform for users to access. This structure, the government will pay a token on a quarterly basis just to keep the platform running, and the government will continue to manage that. The funders have provided the initial investment to keep it running, but then government knows what it costs and they are willing to run with it. How that will be structured, I don't know, but then they have that capacity. So in terms of coverage, it covers 5 programs: vaccines, malaria, family planning, maternal and child health, HIV and AIDS. And for HIV and malaria, the scope is across the country. All the states are covered, and TB program, and all the LGAs, local governments, are covered. And like I said, there are over 40,000 health facilities that are hosted in the program, on the platform. But a majority of them are public health facility. A few of them are private health facility, all hosted on the platform. So the other information that I want to provide is that the master data itself from this platform comes from Nigeria Health Facility Repository, which is called Health Facility Registry, which is also co-linked with DHIS 2.0. So that is where the facility list has come from for this platform. So it's holistic and the coverage is total. Thank you.
Okay, thank you. I think there's a question here talking about the maintenance cost. And in the process of answering responding to the questions that were asked, he mentioned that government is to pay some money for this. So we may not want to begin to break it down, but the arrangement is already there. The government will pay to continue benefiting from the arrangement now. There's this question also. Is applaud the person that asked the question is applauding the system. The process is beautiful, but the person is skeptical because despite the good features with the platforms, the NHLMIS and the GFP van, there are still stockouts out there in the field of the various commodities. So, and the person is wondering how we can ensure that these good processes are translated to positive results where we will have a non-stockout and then continuous product availability.
This is straightforward. So I'm happy the person asked. Before now, we don't have visibility. We were dark to what the processes were or what our realities are. Now we have one-stop shop that has given us visibility down to the last mile for all facilities. So with this, it brings about accountability for all the actors along the chain. And these actors will begin to act. And once they act, it begins to address all the issues. Like we have seen down the chain, we have increasing reduction in terms of our stockout incidents as visibility improves. So people are now aware, people are taking action, and we are beginning to see an improvement in commodity security.
So as a moderator, I shouldn't be answering this question, but I think it's important that we understand where we came from and where we are now. Where we are now, in Nigeria, we did try visibility systems for the past over the past 15 years, but it never yielded any fruit. But now we're at a point where if a facility in Kutuwenji, for example, runs out of an FP commodity, the system tells us to that level which commodity. It tells us when, and it gives us that decision-making ability to say we need additional quantity of those commodities so that to avoid stockout. From an availability standpoint, there are some issues beyond outside of a system control, where we talk about manufacturers' ability to meet the demand. That a system cannot address. That is about capacity of the manufacturers and the right timing of those commodities in terms of forecasting and supply planning. Once that is timed right, commodities coming country at the right time, arrives at the health facilities at the right time. So we would reduce the impact of non-availability, and we can begin to see the gains. This system has only been in place now for the past 2.5 years, and we've seen a lot of changes. So it's a good place where we are now, and we can only improve from where we are. Thank you.
So still to add into this, the, 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 the application tool or technology has a lot to offer to us. When the presentation was going on, we were told that 40,000, over 40,000 facilities have been included or captured in the platform, which is very helpful. It has since we brought in the NHLMIS was brought in. We have been able to harvest consumption data that has helped in a very key way to improve our quantification. So if we're able to get all the health facilities in the country into the NHLMIS form, it will go a long way in reducing poor planning, poor forecasting, poor last mile distribution, and at the end of the day, availability will improve. So I will say that we need to work more closely as stakeholders to ensure that all of these beautiful things are taken forward through proper funding, proper capacity building, engagement with people at the state level so that they too will buy into it, and ensure that the necessary things are done in terms of having the right personnel, um, trend, and then completing the data upload as and when due. And then at the federal level, it's important, as has been mentioned, to link the NHLMIS and the warehouse management information system with the GFP van, so that there will be seamless um, operation in terms of quantification, procurement planning, and then we use it to engage with the manufacturers. So the results, if all these things are done, will be very positive. So I think um, it is a good thing we are doing. We're on the right track. We only need to sustain the process in the coming years, and the good result will show. So thank you for the beautiful presentation. Okay. Do we have questions from the outside audience? Okay.
Yeah, thank you, Mr. Lawrence. There's one more question, and I'll throw it to, I know the answer, but I'll throw it to Abu. Now, the question is the former state and the current state of the system. Do we have a trend analysis that shows the stock out before the system was deployed? And now that the system is deployed, what have we seen an upward trend, and can we provide such information?
Yeah, so the platform keeps a record, digital print of all the activities that were reported in the system from inception to date. So for those who have access, they can. So I will speak from 4 key performance indicators on the dashboard. The first one being the reporting rate, the second one being data quality incidents, the third one being stock out, and then the last one being month of stock, which look at stock imbalance within the system. So progressively, for reporting rates is an upward trend from inception to date. And that is very good. As you can see from the slides, we have more than 8% reporting rates of all across all the programs are currently reporting on the system. For GSC PSM, as you can see, about 98%, which means we have visibility into virtually all the facilities that we support, and that is key. The second one is data quality incidents. So that trend is also on the from inception, where we started with data quality incidents of around 40, 45%, for some programs as high as 80%, there's a downward decline because people at the state level are beginning to ask the service delivery people questions. They're beginning to give feedback to those people to report right. It has served as a tool for mentoring, for supportive visit to this. So all these actions has contributed to a decline in data quality incidents that is being reported. It fluctuates depending on the activities within the system. So in terms of stock out, depending on global availability, depending on funding constraints, it's a mixture of both. So but the good thing is you have that visibility to be able to take decisions. So for some, for stock out, it's on the decline, and sometimes you see a spike when the stock is not there. And what that tells us is that it will guide us to plan around these issues that we have identified as part of the trend within the system. You look at it, so when am I stocking out? Is it just before the epidemic for malaria or after the epidemic? What do I need to do? How do I time my arrival? How do I? So all these are things we are beginning to do. But overall, the system has provided that visibility, and the system has given us hope. We see reporting rates, we see data quality incidents, we see stock out incidents, and then the last part, which is that month of stock. You can see individual facilities that are overstock and those that are stock out. And the state people are able to take decision to move these commodities around, looking at that month of stock to address those stock imbalance without necessarily resorting to the next the central system for emergency supply. So that happens, and that is what the tool has done for us. And it's a good thing for the country. Thank you.
I think the session has been quite educating and very interesting. The good features that have been outlined here today have been identified already by the Federal Ministry of Health, and the National Product Supply Chain Management System is already running with it. Plans are being put in place to ensure that the application across the country is scaled up to cover all the states and bring in all the health facilities. So once this is done, we're good to go. We'll be good to reduce or bring to zero stockouts. But as Abu said, we have to ensure that the upstream side is working very well. We have to fund well. We have to put in place good practices that will ensure that we quantify well and distribute as and when due. The beauty of this is that we have something that is working, something that is promising. All the stakeholders, including government, should work together to ensure that it translates to the success that we are seeing. We remain grateful to Global Health Supply Chain System PSM Management Project for facilitating the development and rollout, and we plead that you continue to support until government is able to take over. We thank also UNFP and other USAID and other partners that have been supporting for this. It will be good for them to continue providing financial and technical support for the sustainability of this system. So once at this point, I want to thank the co-moderator, Kenny, and then the presenters, Maria, Runo, Abu, and Atoyese. Thank you very much for the good presentation. And the audience, thank you for the patience you have exhibited. Thank you very much. So I hand over to Dr. Shegu for closing.
Well, thank you so much. It's been a long day. A round of applause again for this wonderful panel. Tomorrow, if you look at your program, we're starting